And welcome back to the Morning Blend with our continuing series, Insurance 101. With the new year comes new goals, and one thing we can all agree on that is a good idea is saving money.
That's right, but when it comes close to retirement and the transition to Medicare, there are some things that you should consider for your budget. Joining us now is Luke Stecker. He is with Great Lakes Medicare Solutions with ways to manage your health care on a fixed income in retirement. So lots of people want to know how to do that. Good to see you again.
Absolutely. Thank you for having me on.
Yeah, Happy New Year.
Yeah, Happy New Year to you both.
A lot of people are thinking about their goals. They're thinking they are on a fixed income, so there's not a whole lot of extra money. And that's one thing I think, we can always agree on the saving money, but there's some challenges that people might face in regards to budgeting for Medicare coverage. How do you suggest that they kind of manage that?
Yeah, absolutely. So Medicare costs do change year after year. So do plans, so do providers. So it's really smart to take a look at these things and really understand what you're getting yourself into prior to signing on that dotted line, so to speak.
Yeah.
So for older adults on a fixed income or limited income, it does make a lot of sense to kind of take a step back and really analyze what your out-of-pocket expenses are going to be, and knowing what your projected Medicare costs are going to be based on copayment amounts, deductibles, and cost sharing.
Yeah.
Well, and I'm glad that you mentioned that the costs change from year to year. The other thing that we know is that our health needs change too, maybe from year to year, and healthcare costs.
Correct.
It seems like they keep going up.
Yeah, I mean, with the rise of healthcare costs, like you said, and healthcare needs changing from year to year, I mean, we get older, our bodies shut down a little bit. So it is, like you said, always smart to consider those things moving forward.
Yeah. So these are some things that you suggest budgeting for with Medicare payments. The first is your health status.
Yes. Yeah, so health status is kind of my number one, based on your current healthcare utilization, how often are you seeing a doctor, a specialist, what medications are you on, really come into, what makes the most sense for you. So it really will depend on how much you pay based on your healthcare needs currently. There are a few other things like your plan selection. Would it make more sense for an individual to do a more pay-as-you-go system with a Medicare Advantage, where you pay co-payments and deductibles each time you go into a provider?
Right.
Or a Medicare supplement where it's a fixed amount each month, no matter if you go in or not.
So depending on how healthy you are and the things that you need.
Exactly.
Yeah.
And that's my favorite portion of sitting down with people, is kind of mapping out a year of healthcare.
Yeah.
What does it look like? What does your month look like? What does next month look like? And really starting to put, the pen to the paper here and see where I can save people money.
And knowing if the plan is in network is a big part of it too, right?
Huge aspect is the plan's network, as well as formularies, ensuring that your providers are all in your plan's, directory. So you can go see them for the lowest out-of-pocket expenses. And then one other major component would be other insurance.
Yeah.
If you currently have, employer group coverage through your employer, you should really contact your health benefit plan administrator to ensure that your plan does or doesn't work with Medicare, because that's another big determining factor if it makes sense to make the transition or if you should stay put for a while.
That's good, because I think that's a huge decision in terms of saving money. The other thing is, if they're doing it, can you help people with financial assistance? Is that ever something that happens?
Yeah, so people who qualify for eligibility for help with Medicare or their prescriptions do qualify for extra assistance, and we can definitely point them in the right direction.
Okay.
And of course, if somebody isn't working with, a financial advisor or a guide managing their money, we can also point them in the right direction, as you are well aware.
Yeah.
And it's important too. I think if people are either trying to maintain what they currently have on Medicare, they want to maybe trim their costs and take a closer look at that, they can attend some of your seminars, the Medicare Solutions Road to Medicare, where they can get some of those questions answered and kind of have an opportunity to see that there are other options out there.
Absolutely, yeah. So at my free educational events, I go over all of the plan options so you can really understand what you'd be getting yourself into with an Advantage plan and what you would with a supplement, as well as other election periods to know when and if you are eligible for a new plan or a plan change. So
And you don't go over specific plans during that, right?
Not at all. Yep,
Yeah.
that's more so on a one-on-one basis. So it's just straight information from CMS, just getting everybody up to speed on what is available and what's out there, and then sitting down with that one-on-one, consultation to really evaluate healthcare and budgeting.
Do you find that people are oftentimes really confused? Because I think that's the biggest thing. Like I've said it before, that I've often found, like when my mom first went on Medicare and such, it was just so confusing that she really needed somebody in her corner. And I think that's, really a cool opportunity you have when you work with people.
Definitely. I mean, it's kind of fun going into a home and they've saved their mail.
Yeah.
They just turned 65 and
Piles
they have
of it.
40 pieces of mail all saying the same exact thing. It's really fun to go in and really, again, kind of siphon through the noise and really make sense of it all, because I think a lot of the print and the over analyzing and over information is set to confuse people.
Yeah.
And we really do, again, clear out all the smoke.
It can be overwhelming. Yeah, you'll meet with people at your office. You'll also go out and meet where it's comfortable and convenient in people's homes, which is nice. People can give you a call for an appointment, which is free. The consultation is they can also attend these wonderful sessions that you just mentioned. So the next one coming up Monday, January 13th at 10 a.m. It's the Road to Medicare. Their offices are located on 124th Street in Brookfield. And as Tiff mentioned, not going over plan specifics, but answering questions and giving people a great general overview of what all is going on. People can call to have a no-cost consultation. It's 262-358-8734. They can also visit you online too to get more information.
Thanks,
Great to see
Luke.
you.
Yeah, thanks
Thank
for
you
having
so
me. I really
much.
appreciate
Yeah,
it.
good to
Appreciate
see you.